at 12:30, and I've got my colleague Frida here. You can see her coming into the camera from time to time, so she's keeping me right, and my colleague Michael is also in the background. So just to say to you that just those of you who've just joined, we are going to be recording this, but obviously that's for our own use. So just to make you aware of that. So my job is always a pleasant job when it comes to this. So my job is to welcome you, and I'm really pleased to see so many people engaging with this event. This is a topic close to my own heart, very personal to me. But my name is Barry Quinn, and I'm one of the lecturers, senior lecturers at Queen's University in Belfast. I'd like to say that is one of our buildings, but it'll come as no surprise to you that the School of Nursing and Midwifery does not sit within that beautiful building. So we're a couple of streets away, but we're allowed to visit it from time to time. But of course, some of you may have been to that building, and it was very dominant in the news recently with the celebration of the 25 years of the Good Friday Agreement. Part of my role in the university, so up until about 4 years ago, I had roles as a director of nursing in London. That's where most of my clinical work took place. My clinical background is cancer and palliative care. And some of the things that Michael and Frida are going to be talking to you about is, was very prevalent in my role as a director of nursing, but also, working with colleagues and working with people from diverse communities across London. Wonderful place to work, and some of you are there. And Belfast equally so, again, great diversity within Belfast. But part of my role when I came here about 4 years ago was to take on the lead for equality, diversity and inclusion. And again, it's really been a wonderful thing to be involved in, and I've learned so much. So we're just going to show you the program, and then I'll just say a little bit more. So Frida will click on to the next slide for me. Thank you. So this is the program. So I will say a few words around equality, diversity and inclusion in relation to the topic. And then Michael will come in, Professor Michael Brown will come in and talk about why we did the study, why they did the study. Then Dr. Frida McCormick will come in and talk about what Michael and the wider team did, Frida, and what they defined. And then Michael will also talk about the launch of the LGBTQ+ Health Academic Network, and then we will have an open forum. Now, just to say that throughout the presentation, we would absolutely love to hear what you're doing in practice or in your academic institutions. Just to say, this is something I learned a number of years ago, and this is the good news. There is no such thing as an expert in EDI. And if you meet one, stay well clear of them. There are no experts. I must say that most of what I've learned around equality, diversity and inclusion has been through lived experience of being with friends, with colleagues, with people I've cared for, and my own personal reflection. I have read lots of books on it, but to be honest, what I've learned most is about engaging with people. So it'd be lovely to hear your own thoughts around that. Okay, I'm just going to move on to the next slide and just a couple of reflections. I want to say to you, this is a safe space. Whenever I talk about equality, diversity, inclusion within the school or maybe in other arenas, I always like to say this is a safe space. You can't make mistakes. You can't make mistakes as long as we've got that humility and that sensitivity to one another. So mindful, there are no experts. This is a safe place. You can ask anything you want. There is no such thing as a silly question. I also want to say, you probably are aware yourself that when we talk about equality, diversity, inclusion, there is some debate whether it should be equity, diversity and inclusion. And I think that there's a recognition that equality works well if you live in a just and a fair world. Well, we don't live in a just and fair world. We live in an unjust and an unfair world. So possibly equity, fairness and justice is an important part of the conversation today. We are going to talk about one of the protected characteristics, and there are many, so whether it's around age, whether it's around disability, whether I choose to reveal my disability or not, whether it's a mental health one, whether it's a physical one or a learning disability, whether it's around my gender, whether it's around my marriage or civil partnership, my sexual orientation, or whether I'm going through gender reassignment, or whether, I am, going through support for maternity and pregnancy services. I want to say, when we talk about lesbian, gay, bisexual, transgender, and queer plus communities, I'm not saying you might disagree with me, but I don't think there is such thing as a community. There is not such. And I think, in fact, by thinking there is a community, there is a good chance we're going to exclude people. We are all human beings, and some of us, all of us, will be influenced by these protected characteristics. So whenever I'm talking about this subject around equality, diversity, and inclusion, I ask people to think about which of the protected characteristics apply to me. As a man, as an older man, as a gay man, as somebody who's lived with a mental health concern, and it goes on and on. But all of us, so I think that's a good place to start with. What protected characteristics relate to me personally? And perhaps that allows me to be a bit more open to other people's protected characteristics. So why do these things matter when we focus around people who identify as lesbian, gay, bisexual, transgender, queer, intersex, other? And I'm learning about this terminology all the time, so it's continually growing. So yes, I make mistakes and you make mistakes, and that's fine. And I'm sure Michael and Frida will talk about that. But I often hear people say, why don't these people access our services? Why is it we don't see enough lesbian and gay and bisexual and transgender and queer people? Why are they not using our services? There's a good chance that when we set up the service, we may not have talked to them and included them in the design of the services. And I think that's also true of other protected characteristics. So whether it is consciously or unconsciously, people can feel excluded. So I've met many, many good and loving nurses and midwives who are very open to the conversation around equality, diversity, and inclusion. But the personal experience of many people who have protected characteristics has been one of unfairness and of injustice and being treated badly. So therefore, they come to health and social care, they come to the university setting with some concerns, which, and it's something about me making visible the fact that I am a safe person to talk to, and to learn from them and to learn from one another. So I think the overall message of today is not about preaching, it's about learning from one another. And I think we were talking about this ourselves this morning, Frida, Michael and myself, well, what can we do as a university? What more can we do as a university, supporting students from across the world? What can we do? So we've sort of made a commitment to ourselves that following this work, that we are going to set up a task and finish group to look at one or two simple things that we could do to implement into the curriculum to make our curriculum, our university, our school, an even more inclusive place to come and to work. So lots of things to think about, but I think I will leave it there. So I'm going to hand you over to Professor Michael Brown, and I'm sure many of you know about Michael, and you know about his work and about his publication. But I'm sure he'll tell you a little bit about himself, but also talk about the focus of today. So a safe place, no experts, and let's learn from one another. I'll hand it over to you, Michael. Michael, you just need to mute.
Thanks very much, Barry. I'm really pleased to be here, and it's great to see so many friends and colleagues from Northern Ireland and across the UK and the Republic of Ireland. You're all very, very welcome. What I'm going to talk about is an ongoing journey, which I think Barry referred to. And this journey has included research around what exactly are we doing and what do we need to do, or what could we do and what can we do regarding LGBTQ plus health, and where does it sit, or I think as possibly we'll find, where does it not sit within our pre-registration undergraduate nursing and midwifery programs. So the first part, before I hand over to Frida, I'll be walking us through some of the international literature that relates to health professions in general, but looks at nurses and midwives more specifically. And that will then lead us into what we actually did. And Frida will walk us through that, what we actually found, what we think needs to happen, and what has led us here to today. So please use the chat. It would be great if you could tell us who you are, which institution you're from, and what your interest is in this area. As Barry was saying, we're on a journey here, and there's no experts, and it is a safe place. So to get the show on the road, we were funded by the Burdett Trust for Nursing, who we've had a long partnership with. So I was the principal investigator. I've been at Queen's here in Belfast for 7 odd years. Prior to that, I was professor in Edinburgh. Been working with Dr. Edward McCann, who some of you may know, who was an associate professor at Trinity College Dublin. And we've been working in and around this space regarding LGBTQ plus health, particularly around health inequalities, healthcare access, healthcare barriers. And we were really interested around the views and experiences of LGBTQ plus people. Barry made a really, really important point that I want to pick up, and it's breaking down that L, the G, the B, the T, the Q, the plus. It changes constantly, and there's bits being added to it. So really important issues to think sort of conceptually, that the needs of lesbian women, for example, are not the same as a bisexual man, that are not the same as a transgender person. So just really, whilst we use these kind of rainbow umbrella terms, we need to think about the subpopulations that sit within them. As a part of this, Dr. McCann and I applied for this funding, and that's where Dr. Frida McCormack, who you'll hear from, joined us on this journey. So this is the main kind of research team. We involved project advisors from a range of LGBTQ plus organizations, stakeholders, and I'll talk a little bit more about them. But this is the main team who were involved in the research study. So as I said, funded by the Burdett Trust, who I think, as many of you know, if you've been successful in gaining funding from them, are really an important funder for nurses and midwives. They are in a fortunate position, unlike some of the big funding councils, that they can fund emerging issues or fund studies and project and work that's important to them, that enables people to ask questions around issues and concerns to nurses and to midwives that may not be very amenable or accessible for wider funding. So we were very grateful to them and to their support. I also need to mention Professor Brian Webster Henderson, who is Pro Vice Chancellor at University of Cumbria. He's currently chair of the Council of Deans, and he's been hugely supportive of this work in terms of access. And he was a part of our project advisory group. We also need to think about the pre-registration programmes and the academics. Across the UK and the Republic of Ireland, there are about 135 schools of nursing and midwifery. Approximately half of them, so about 75, deliver midwifery programmes. The other 100, the others deliver a range of the adult programs, child health, mental health, and learning disabilities. So actually trying to gain access to all of the leads within the school so that we could access potential participants was one of the challenges, but we used a mixed methods research design to be able to do that. And we did network across every school of nursing and midwifery in the UK, so Northern Ireland, Scotland, Wales, and England, as well as the Republic of Ireland. So that's just a little bit of the context of what we were funded to do. So we need to thank the Burdett Trust. I need to thank the nursing and midwifery academics who participated in the surveys, in the interviews, the project advisory group. These were colleagues who came from LGBTQ plus organisations, the Royal College of Nursing, Royal College of Midwives, there was a whole range of them who were very, very useful. We also had students involved in the project advisory group, as well as academics who actually try to include and integrate LGBTQ plus health. And I need to thank Gary Gilmore, who's the graphic designer, who's worked with us very closely from the start to pick up the main messages and the imaging. And it's been fascinating to work with him over the past couple of years around how do we join up the issues of rainbow LGBTQ plus linked to academia, linked to healthcare and healthcare access. So all the lovely slides that you'll see, it's him that's done this, all the project reports, all the messaging has been from him, and we're very grateful for the work. If anybody's looking for an innovative graphic designer, he would be the one to go to. So what did we do here? So the study was done in 3 distinct interrelated phases. The first phase was looking at policies and standards. So we looked at legislation policy on a global basis, as well as the UK and the Republic. Many of the legislative and policy decisions, particularly in the UK, are devolved issues. So they sit with the Northern Ireland Assembly, the Welsh Assembly, the Scottish Government, and the UK Government. So that was an interesting issue to look, well, where does LGBTQ plus health sit? What legislation is in place on a global basis? And there's been major changes in many, many jurisdictions where legislation has been passed around marriage equality, policies looking at health inequalities, healthcare access, and how do we improve the healthcare access and healthcare outcomes for LGBTQ plus people. But an important point to make is that, as Barry highlighted it at the start, we're on a journey, and there are still countries across the world where being LGBTQ plus continues to be an offence. And some people, if they were to disclose their sexual identity, could place them at risk of harm, discrimination, and imprisonment, and in some places even death. So there's lots of progress has been made in many different places, but there's still lots of work to be done. We looked at the standards from the Nursing and Midwifery Council. We looked at the NMBI standards in the Republic. We looked at others to see, well, where does LGBTQ plus sit? What reference is there to it? And often there isn't much specific reference to LGBTQ plus people as a distinct group, but what you will find in the standards that the universities have to then interpret in terms of the programs that they design, put through validation and approval, and then subsequently deliver, is around equality and diversity, social inclusion, social justice. So that therefore leaves it fairly wide open to individual institutions and the academics within them to make decisions around what emphasis they place on issues such as LGBTQ plus health. We also undertook several very detailed reviews of the international literature to see exactly where LGBTQ plus sits, what are people doing, what are the barriers, what are the gaps, what are the innovations, and there are lots, and we'll share some of that with you. We surveyed, we developed a survey, gained ethics, all the usual stuff, and we went across every university and school of nursing in the UK and Ireland. It probably, in truth, was not the best time to be doing this at the start of a global pandemic, but because of our funding, we had to get going on the study. So I think perhaps, as you'll see from Frida, some of the responses were perhaps not as great as we had hoped, but we did hear from about a third of the schools of nursing and midwifery across the UK and Ireland. Data analysis, data synthesis from the stage 1 then led to the identification of participants for the qualitative interviews in phase 2. And then we synthesized the literature, the findings from phase 1 with the findings from phase 2. We then did a mapping exercise looking at our findings in relation to the standards for nursing and midwifery, pre-registration programs for the NMC and the Nursing Midwifery Board for Ireland, to see where there were opportunities to more fully embed LGBTQ plus health. And there's actually loads of opportunities and hooks, and we'll share some of them with you. Another thing that we were really interested in trying to identify was best practice and innovation that our education colleagues, nurses and midwives were trying to implement. So what were they doing? What resources were they using? How were they implementing it in terms of theory, simulation, workshops? How were they involving LGBTQ plus people, organizations in terms of the evaluation, the design and the delivery of their undergraduate pre-registration program? And then the phase 3, we had a dissemination event for the main findings last year. There's a range of publications presenting at events and conferences and things that we've been doing. And then we've continued to work in partnership with Burdett, who provided funding to enable us to establish this academic network. And we also received additional funding from Queen's here in Belfast. So those are the 3 phases, and I'll talk you through now the project advisory group, experts from LGBTQ+, academics, students, professional bodies. They were very, very useful for us, providing literature, resources, providing examples of best practice regarding LGBTQ+ health and how they were integrating it within their programs. They provided us with excellent guidance and advice. The project advisory group met periodically throughout the life of the study, and we've been in touch with them, and most of them are agreeable to continue to be our advisory group as we set up and establish and take forward this academic network. And they supported us through their organizations, their newsletters, their webinars, and all these various other things to disseminate the study and the findings. So we're very grateful for them, for their knowledge, skills, and expertise. So just to place the work in a wider context, some of you will be very familiar with lots of these issues. So this will be a bit of a refresh and a recap. For others, this may not be so well known. There's been a range of policies from the Health Service Executive in the Republic of Ireland, in the Department of Health in England. For example, adequate health care for all looks a lot at these issues regarding equality of access, equality of outcome, and what LGBTQ plus people should rightly expect when they access either healthcare or maternity care. Some of the kind of wider issues, the World Health Organization published a very important report back in 2015 about social inclusion and human rights. And I alluded to some of these issues, that being LGBTQ plus in many countries across the world, particularly here in the EU, we've seen many changes, very positive things happen, but that's not the case for everybody. And that World Health Organization report is definitely worth a read if you're thinking about what can we do within our pre-registration program. It sets a very wide, relevant and appropriate social inclusion and human rights context for this work. As I'll pick up, the literature very clearly talks about and evidences that whilst many positive changes have taken place, many LGBTQ plus people continue to experience marginalization, exclusion, and discrimination in many aspects of their life. And this also applies when they seek access to healthcare and maternity care, where sometimes they'll continue to experience negative attitudes, where the knowledge and skills and understanding of the healthcare professional may not be as well developed as it could be. And therefore, it means that there's an issue regarding the biosocial and cultural needs of LGBTQ plus people when they seek access to healthcare. And as a result, there's issues about responsiveness, appropriateness, and thinking about the use of the resources that we have within healthcare, and how those are used to take account of the distinct needs of LGBTQ plus patients when they seek access to healthcare. And a big part of the wider concerns is ensuring that we have a knowledgeable and skilled health practitioner workforce, which includes nurses, midwives, doctors, AHPs, many others. Our work is particularly concerned about nurses and midwives. That's not to not recognize that there are others, doctors, AHPs, others who also have particular needs. But our focus over the past couple of years has been regarding nurses and midwives, and there may be wider work that will evolve from this that will include other healthcare groups also. So just by way of a little bit of an update and an overview, when you look at the international research, literature, and evidence, which we did as a part of this would be a separate lecture all in its own right. But just to kind of place our work and our work as educators in a wider context, there's a range of health concerns that are experienced across the lifespan by many LGBTQ plus people. Some of them may be experienced by LGBTQ plus youth, adults, older people. Some of them may be more prevalent in particular subgroups. So, for example, lesbian women, transgender people, gay men, or bisexuals. But there's very clear evidence when you look across the international research literature regarding issues such as depression and anxiety, often linked to fear of discrimination and social exclusion. Suicidality is an issue for some eating disorders can be common. Alcohol and substance use are particularly prevalent. Fear of victimization, harm, violence, exploitation, stigma, the kind of list goes on. And from a physical health point of view, some of the obvious ones, particularly relating to men, but certainly lots of changes there regarding HIV risk, STIs, cancer. There's a whole range of them, physical and psychosocial concerns. So when thinking about nurses and midwives, our programs, our pre-registration programs, whether it's in adult, midwifery, child health, learning disabilities, mental health, will somewhere have theory and practice components that pick up these psychosocial issues. We will be teaching our undergraduate students about heart disease, about cancer. So there's opportunities within our programs to think and identify areas and spaces where LGBTQ plus sits, if it's not already there. So the first big piece of work that Dr. McCann and I undertook was a literature review looking at where LGBTQ plus health issues sit. Now, we included all undergraduate healthcare education, so nurses, midwives, AHPs, doctors, and where does this issue of LGBTQ plus health actually sit? And what are the educational needs, and what does the literature tell us regarding the approaches that are currently being used to integrate this issue within pre-registration education? So this was one of the first pieces of work that we did. There were 22 international papers that we identified out of a possible 943 that focus specifically on this education focus. And what they were looking at was cultural competence and inclusivity. So how do they start to prepare our pre-registration students, nurses, midwives, medical students, and others regarding this issue of recognizing the cultural needs to increase their competence as a means to increase the inclusivity of LGBTQ plus people. A lot of the research studies, or some of them, have done post-test interventions where they have assessed pre-registration students, nurses, midwives, doctors are particularly common, regarding their knowledge, skills, attitudes, and values regarding LGBTQ plus health. Then there's an education intervention, and then following the education, looking at changes in attitudes. Quite a few studies have looked at that. Some of the other literature has looked at, well, what curriculum developments are currently taking place to include and integrate LGBTQ plus health within pre-registration programs. But importantly, how do we assess these outcomes? How do we know that our pre-registration students know the things that we want them to know? I can probably hear some of you laugh because that is a major issue, not just in relation to LGBTQ plus health, but there's something there about assessing education outcome and students' knowledge so that they can begin to think about how they apply this confidently and competently when they join the healthcare workforce. And then as part of the questions, when we looked at the review of the 22 research studies, we were looking for innovation and best practice. What do academics think that they're doing well? What have they researched in terms of the pedagogical teaching and learning approaches that they've utilized to integrate LGBTQ plus health within the education programs? So that was part of what we looked at within that literature review. And what we found is, I'll be honest, it's a bit of a mixed bag. There are clearly examples of academics making very strong attempts to embed LGBTQ plus health within education programs. And I would say with varying levels of success. That's probably not surprising. Any of us who've involved in the review, the design and the implementation of any pre-registration program knows the massive pressure. Everybody wants to put more in, but nobody wants to take anything out. And that's a major challenge for us all. So what we would conclude on the literature that there is that it's probably patchy. In some programs, it's probably limited and it's highly variable with no real national standards or guidance regarding, well, what exactly should be included in terms of theory, in terms of practice assessment, of the delivery methods, of practice learning. So how would we competently be able to measure and know what the knowledge, skills and attitudes are of our pre-registration students when they exit their education program? A range of approaches are being used regarding teaching and learning. And these were some of the things that we were particularly interested in. What is it that academics are doing in terms of pedagogical approaches to try and embed this? And there's some very interesting and innovative approaches. I also know that we have some colleagues from health and social care trusts on the call. So they're particularly interested from a CPD point of view. So beyond pre-registration, how do they then begin to build the knowledge, skills and competence of their health and social care workforce colleagues to ensure that they're building that knowledge and skill base? Very few studies had actually formally evaluated how they had integrated LGBTQ plus within their education programs. So therefore, there is an opportunity for my academic colleagues who are more interested in pedagogical research and outcomes to undertake work in that space. So some of the implications that we thought is there have clearly been many positive legislation and policy developments have taken place across the UK and the Republic of Ireland, as well as more widely on an international basis. This is focusing on issues around human rights, social inclusion, equality and diversity. So there's a real springboard there that we can begin to think, well, how do we utilize this legislation and policy to present that wider context to our pre-registration students? There's probably gaps in our education programs regarding cultural competence and confidence of our pre-registration students regarding LGBTQ plus health. So opportunities when we're teaching cardiac, respiratory, mental health care to think about, are there examples from the literature and the evidence of the health needs and the health inequalities experienced by LGBTQ plus people that we can start to use? Thinking about our biopsychosocial elements of our undergraduate programs, where could we see hooks that we can utilize to integrate some of these issues? Ultimately, what we're trying to do is improve the knowledge, attitudes, and the skills of our pre-registration students. So at the point of entry to the register, they're more knowledgeable and skilled. There's possibly more work that the professional bodies such as the General Medical Council, Royal College of Nursing, Nursing Midwifery Board and the NMC could be thinking about in relation to LGBTQ plus people as a subpopulation of that wider EDI work. And then issues about how do we work with our colleagues and partners in the independent sector who are working with LGBTQ plus people to get their knowledge and skills as advisors when we're designing programs, implementing them, and we're assessing the knowledge and skills of our pre-registration students. And therefore, because the evidence base in this area is growing and evolving, there's opportunities for multi-centre and longitudinal studies to look at how knowledge, skills and attitudes change, perhaps through the lens of LGBTQ+ people, or through the lens of our students as they move in to their posts within health and social care. We then undertook a review of the literature and evidence looking at the experiences of LGBTQ+ people in relation to midwifery care and supports. And we were very fortunate that Professor Caroline Hollins-Martin, who is at Edinburgh Napier, was involved in this, and Jerry McLaughlin, who's at University College Cork. They're part of the midwifery teams. They were involved in this, as well as colleagues from the Royal College of Midwives. I have a nursing background, so acutely aware that we need to get the expertise of our midwifery colleagues. So out of this, there was less literature here. There was 9 out of 139 possible studies, and the main themes that we identified from the existing midwifery lecture really talked about LGBTQ+ people who are contemplating pregnancy and what their antenatal experiences are as service users of maternity care. So a very mixed bag there. The other things we looked at was the experiences during pregnancy, labour issues, and the concerns that LGBTQ+ people, either as the patient or a partner, experienced when in receipt of maternity